We are here with Dr. Markus Renner, Chair of the International Brand and Reputation Community. Markus, welcome. So I guess the first thing we wanted to talk about really are some of the challenges that you see in building reputation in such a complex sector as healthcare.
Yeah, the healthcare sector indeed is very complex. So in science we call it the trust sector. And I'm going to explain what I mean by that. It is a trust sector, so we differentiate three types of trust. So one is the general trust, that is when we, for example, buy jeans or whatever. So that is something that you can test beforehand, yeah, or shoes, and then you wear it, and they say, I like it or I don't like it. So it's an easy one. That is, we call that, it's an experience factor. And we also have search goods that you evaluate or assess either before or during or upon consumption. Yeah, but trust on the healthcare sector, you cannot even evaluate. Sometimes you cannot, or most of the times, for example, the patient cannot evaluate what he's getting, what he's being the prescription or the drugs he's taking or therapy. Sometimes, because it's so complex, the whole sector, you'll not be able to really evaluate or assess it. And that is for two reasons. One reason is we have a information asymmetry. Yeah, because the scientist behind it or the doctor knows a lot and you don't know, and you're not able to know that, to be on the same level as the scientists are. And then on the other hand, you have the high risk at stake, which in the end it's your life. And these two factors are very special. That makes the industry so special, and that is where risk and trust and reputation become so important. And we also know that reputation reduces perceived risk. That is very important. So having a good reputation reduces that risk perception.
Okay, so thinking specifically about AMCs then, and how does their reputation influence attractiveness as a partner, for example, in innovation and research?
So strong, reputed AMCs, they can function as a risk reducer. Yeah, for example, giving science. If you cooperate, if pharma companies cooperate with highly reputed AMCs or doing the trials with them, that gives a clear signal to, for example, investors or the regulators, that they will handle the data and to conduct the trials in a very high quality manner and deliver high quality data, which is extremely important. This is one thing. The other thing is that is a kind of halo effect. Yeah, so you have a halo effect when you're working together with highly reputed here, number one, number two in the ranking, the brand finance ranking, like Johns Hopkins or Charité, Berlin, or Oxford University. That halo effect can even transfer to the therapy and the drugs that is later on the market.
Perfect. Thank you so much.
Thank you.